to the COVID cases that continue to rise. The active case count has now, in fact, crossed the 4,000 mark in the country. 5 deaths have been reported in 24 hours. Kerala has the highest caseload at 1,416 cases. The numbers on the different states, as you can see, followed by Maharashtra with 494 cases. Gujarat, Delhi, as well as West Bengal and Karnataka have also crossed the 300 mark as far as the active cases are concerned. These 6 states are responsible for about 80% of the total active cases in India, and doctors say that there is nothing to panic, but have also advised caution. The surge in cases this year has been driven by 4 variants. As per the reports, the new variant, the NB 1.8.1, is the subvariant that has been detected in India. The World Health Organization's Technical Advisory Group on Virus Evolution has also designated this variant as a variant under monitoring. Take a look at some of these symptoms to watch out for. What is it that you should be worried about? If you have any of these symptoms, you should see whether you have COVID or not and take appropriate precautions. Low-grade fever, a sore throat or dry cough, and also runny or stuffy nose, headache, as well as shortness of breath and diarrhea as well. These are some of the symptoms that the patients of COVID of the new variant have shown as well. Doctors, in fact, have suggested that instead of taking antibiotics, in case of any of these symptoms, each one should reach out to the doctor for advice. And it's not just India, but several countries are also reporting a surge in the COVID cases. But the fatality rate remains low. Most of the people who have tested positive for COVID-19 are displaying very mild symptoms. My colleague Arpita is joining us on the broadcast with the details. Arpita, in Kerala, which has seen the highest number of cases, what are the precautions being taken? Because now concerns are slightly rising, considering the number of active cases have increased.
Well, as of now, Kerala has over 1,400 active COVID-19 cases, and it has recorded the highest number of cases in the state, and it has also recorded 8 confirmed COVID deaths. So now the state continues to report cases where the health minister and chief minister continues to say that it is because of high number of testing, because people who come from abroad and other places. Kerala is a state where continuous testing is happening, and that is why the state continue to record a high number of cases. But they have they have issued advisory for people coming from abroad or for general public in the state, where they have advised elderly people and children and other people who are at risk to continue masking up where they're going out or in public places especially. And they've also asked people who go to hospitals or for any other reasons who visit hospital, they should mask up while they are there. Also, bystanders who are with COVID patients are advised to take COVID test within 7 days, and they're also asked to isolate themselves if they find any COVID symptoms. And they've asked all hospitals to ramp up to PCR kits, and they've asked to continue testing in all hospitals, irrespective if they have any symptoms. Anybody has mild symptoms or anything, they're asked to continue testing.
Okay, all right, Arpita, thank you for joining us with those details. With that, let's get more breaking updates coming in. 45 new cases of coronavirus have been reported in Gautambud, Nagar, with 45 new cases being reported on Tuesday. This is the highest number of infections that have been reported in just a day this year. The information revealed by the officials, 44 of the new patients are being treated with home isolation, and officials say the patients are being treated in private hospitals as well. My colleague Isha is joining us on the broadcast with the details. Isha, 108 cases of coronavirus being reported in the district in the last 11 days, out of which 102 are currently undergoing treatment. What are the details? Because this is the biggest spurt in cases that we've seen in the recent times.
Right, Pratibha. This is definitely the recent spur in cases in the recent times, but it's also important to reiterate that there is absolutely nothing to panic right now, and that is the word that is coming in from the Health Ministry. They've been stating that we are ensuring that every person who gets tested positive is quarantined, and a lot of them are getting better with just a home quarantine. So, at the face of it, it doesn't look like a dangerous bit of the virus. It looks like it is easily treatable at home. But when we speak of the cases, the active number of cases stands at 4,026 according to the Ministry of Health. In fact, we are expecting that the number will be updated shortly because it is a daily bulletin that the Health Ministry undertakes. In fact, as we were also talking about Gautambud, Nagar, 45 cases is what you are saying. In fact, in Delhi as well, cases have been increasing. But yesterday, there were only the cases had dropped down, and the active number of cases in the national capital stands at 393. Like my colleague Arpita was also pointing out, Kerala happens to be the worst affected, and then comes the national capital. So definitely, this is the time to take a lot of precautions. This is the time to keep your masks up, but also important to ensure that this is not a time for panic. This is not looking extremely bad.
Yes.
Back to you.
Okay, all right, Tisha, thank you for joining us with those details. The biggest takeaway, of course, being that we continue taking